Hey everyone, welcome to GrowMed. This channel is a one-stop guide for all the Fmge aspirants, so join with me to make your Fmge preparation easy, fun and enjoyable. Don't forget to subscribe to GrowMed and tap the bell icon to get regular notification. So I am starting a series of the high-yield topics from the OBG, from which surely questions are asked every year and chances are there that questions are asked in the future also from those topics. So today we will be learning about the antepartum hemorrhage, the images, the questions, the type of questions asked in the FMG and how to solve the question, everything. So let's get started. Antepartum hemorrhage, the definition is if there is any bleeding in the genital tract after 28 weeks till delivery, then it will be called as the antepartum hemorrhage. So let's discuss another important point that if it is less than 28 weeks, then it will be called as an abortion. And if it is more than 28 weeks till delivery, then it will be called as the antepartum hemorrhage. And if it is after the delivery of the baby, then it will be called as the postpartum hemorrhage. So remember these three things and you will be able to easily solve the MCQs by remembering these points. Then the antepartum hemorrhage, it is classified into the three types. So there are three types of antepartum hemorrhages. First one is the abruption, then the vasa previa and placenta previa. So let's look at abruption now, all the points. So abruption means the placenta is separated from the uterus. So this is the uterus and suppose this is the placenta. So it gets separated before the delivery. So it will cause bleeding. So this abruption is of three types. Revealed means if this bleeding is coming out, then it is called as revealed. Concealed means the bleeding is present inside only. It is not coming out, then it is called as concealed. And bruised means this bleeding, it will go into the uterine muscles and it will cause hemorrhage in the uterus and it will also go into the other organs and the bleeding will be present in the pouch of Douglas also. Then it is called as the bruised. So this was on the types. Now let's look at the cause. So the abruption is the most common cause of the antepartum hemorrhage and it is disseminated intravascular coagulation. It is a painful condition and the management, the best is immediate induction of labor. That is the termination of the pregnancy. Then the severity is calculated using the Shear and Page classification. So as you can see this image of the coagulate uterus or the bruised uterus where the blood has gone into the uterine muscle causing a massive hemorrhage. Then if one-liner question is asked, then it can be asked like most common cause of antepartum hemorrhage or DIC. And if they've given the image, then by the image you can easily identify it. But in the case, how will you identify it? In the case, there will be described features like painful, bleeding, the fetal parts are not palpable, the uterus is tender, the tender uterus is a catch point. And along with that, the fetal heart rate, it will be absent because the placenta is detached from it, so the blood is not going to the fetus, due to which the fetal heart rate will be absent. So painful and tender uterus, you are sure that it is the abruption. Then looking at the vasa previa. Vasa previa is a painless condition and the blood is of the fetal origin. So this condition is mostly associated with the filamentous placenta. As you can see this image, it is of an filamentous placenta. So image based question can be asked giving this and identify this placenta. Okay, if not a clinical case can be given, we will look at the presentation now. The second image, as you can see here, that due to this filamentous placenta, the blood vessels of the fetus, they are present at the ovary and they can cause bleeding. Whenever there is pressure to it, the fetal head can compress this and it can cause bleeding. So question is asked on the best test to identify vasa previa and it is the Doppler, and usually it is done in the third trimester. Then we will be sure that it is the vasa previa and the management is the cesarean section. And if they describe a case, then the features present in the question will be like painless and the fetal heart rate is absent. So as you can see here in the abruption, it was painful and fetal heart rate was absent, but in vasa previa it will be painless and the fetal heart rate will be absent. And if they give the feature of the blood, then it will be bright red in color. So whenever there is bleeding, we must differentiate it from the mother blood. We need to differentiate that the blood is the maternal origin or the fetal origin, and to do that we will be using the APT test, that is the alkaline phosphatase test, in which to the blood sample they will be giving the NaOH and there will be alkaline denaturation of the maternal blood cells, but the fetal blood cells, they will be resistant to it and they do not denature. So by this test we can distinguish between the type of the blood. So this was important topics regarding the vasa previa. Then moving on to the placenta previa, also a must-do topic, and repeatedly questions are asked, image-based question, especially on this marginal placenta. So in the Jan 24 also this question was asked, and in the past year also this question was asked. So what is placenta previa? Whenever the placenta is present at the os, implanted at the os, then we call it as placenta previa. Like this is the uterus, and this will be the opening, the cervix, and the placenta is implanted here at the opening. Then it will be called as placenta previa. This is also a painless condition, and the gold standard investigation for placenta previa is the USG. The management, it is usually based on the type and the period of gestation. Like if it is at term and if it is presenting with or without bleeding, then we will be doing the lower segment cesarean section, and if it is a complete, then also we will be doing CS. But if it is 32 weeks and presents with bleed, then we will be doing McAfee-Johnson regimen, in which we will be doing resuscitation, rest and steroid. So it is a symptomatic treatment. So let's look at the types. This is the low-lying placenta. It is called as low-lying if it is present within 2 centimeter of the os. Okay. It is called marginal if it is covering present at the margin of the os, and placenta partial if it is covering the os partially, and complete if it is present at the os completely. Completely it is obstructing the os. So in these 3 categories, we can give a trial of the vaginal delivery. If it does not happen, then we will go for cesarean section. And if they gave a case on this, how can you identify it as a placenta previa? In the case, they will be describing it as painless condition, and the fetal heart rate will be present. There will be no harm to the fetus because the bleeding is from the maternal origin. So this was all about the antepartum hemorrhage. There is another important condition which you need to differentiate it from the abruption, that is the uterine rupture, because in uterine rupture you can see that it is also a painful condition, but painful, and in this also the fetal heart rate will be absent, muffled, or it can be tachycardia, and in this the differentiating factor is the fetal parts. They will be palpable, easily palpable, and the patient will be in the shock. So by these 2 things you can differentiate it from the uterine rupture. So that's it in this video, guys. It was a quick revision kind of video on a very important topic, antepartum hemorrhage. I have already made videos on the must-do topic from the gynecology obstetrics, which you can watch to get more clear about the important topics and the topics which you must focus more. Thank you so much for watching this video. I hope this video will be useful to you guys in your preparation. Like the video, share it with your friends, and subscribe to GrowMed for more useful content related to the FMGE. Thank you so much. Bye bye.